The other topic which is related to blood is coagulants. What are coagulants? What is the classification of coagulants? What are the mechanism of action of these coagulants? Therapeutic uses and adverse effects will be discussed in today's class. So what are these coagulants? Before entering into the topic, actually, what is blood? Blood is a fluid connective tissue which is present in the body, and this blood plays a very major important role in the body, and it is mainly useful for the transportation of various organic as well as inorganic compounds which are present in the body or else which are entered into the body. It is a balance between thrombosis and a hemorrhage. If there is any clot or else it causes a balance between thrombosis and hemorrhage. These are like clots which are formed in the body. Thrombosis is a clot which is formed in a particular blood vessel, as well as hemorrhage is a condition or else clot formation in any of the circulatory system. So blood acts as a balance between the thrombosis as well as hemorrhage, and blood maintains hemostasis. Hemostasis is a condition where there occurs proper flow or bleeding of the blood. So what is this coagulation? Coagulation is a process where the formation of clot takes place, or else the clot is formed with the help of various thrombocytes or platelet aggregation cells. These are the cells which aid in the coagulation of the blood. There are various factors which are involved in the coagulation of the blood. So these various factors, they form a net-like thing or else a net-like structure where it prevents the loss of blood forming a clot or a fibrin clot in the particular site where there is excessive bleeding. So this coagulation plays a very major important role if there is any damage to the tissue or if there is any excessive hemorrhage occurring in the body or a blood vessel. Damaged blood vessel is covered if there is any damage occurring in the particular site or else in the body. Then it forms or else it is covered by a platelet fibrin structure, or else it forms a net-like structure at the place of injury. It looks like it is made up of a fibrin as well as platelet aggregating factors combination. So these are combined to form a net-like structure where it is covered to the wall of the damaged blood vessel, and thereby it is preventing the loss of blood by forming a clot. What are these coagulants? Coagulants are the agents which aid in the formation of clot, or else they are involved in the process of coagulation. So these coagulants are indicated in the hemorrhagic states. If there is any excessive loss of blood or else if there is any hemorrhagic conditions, then these coagulants are mostly preferred. So these coagulants, they do not dissolve any formed clot, but they prevent the thrombosis or else they aid in the clot or thrombosis formation if there is any excessive bleeding in the site of injury or damage to the particular tissue. Here we can see this pictorial representation of coagulation cascade. This coagulation process occurs in mainly three pathways. Majorly two pathways are present, that is intrinsic pathway, extrinsic pathway. But there is another pathway called as common pathway. This common pathway is it is a step where the intrinsic factor as well as extrinsic factor undergo this common step. So that is the reason this common pathway is given as a separate pathway. Here we can see there are various factors of coagulation. So here factor 12 is converted to 12A, and from this factor 12A aids in the conversion of factor 11 to 11A, and this aids in the conversion of factor 9 to 9A, and this aids in the conversion of factor 10 to 10A. This conversion of factor 9 to 10 is a very important step because it involves the other factor called as factor 8 along with the calcium. It utilizes the calcium which is present in the tissue, and this conversion takes place. Here the conversion of 10 to 10A is occurring in both extrinsic as well as intrinsic pathway, and this is the common point where both the pathways undergo, that is the conversion of 10 to 10A, and this 10A, it utilizes factor 5 as well as calcium in order for the conversion of inactive form of prothrombin to active form of prothrombin. So when this active form of prothrombin is formed, that is called thrombin, it aids in the formation of clot. Here the thrombin, it is a serine protease. It is a kind of serine protease protein, and where it causes the conversion of fibrinogen to fibrin, and this fibrin is in turn converted to stable fibrin in the presence of a factor called as 13A, where it is formed from factor 13. So all the factors are in inactive forms. These are converted to active forms initially, and there they aid in the formation of fibrin to stable fibrin, where it forms the clot. What are the various blood clotting factors? We have some factors 7, 2, 1 and 1, 5, etc. So what are the names of these factors given? So factor 1 is called as fibrinogen, factor 2 is prothrombin, factor T is tissue factor or thromboplastin, factor 4 is calcium, factor 5 is proaxilurine, or which is also called as labile factor. Factor 7 is not an independent factor. The name is yet not given, but nowadays the research shows that the factor 6 is given a name called as axilurine. Factor 7 is proconvertin or stable factor. Factor 8 is anti-hemophilic factor or globulin A. Factor 9 is anti-hemophilic factor B or Christmas factor. Factor 10 is Stewart-Prover factor. Factor 11 is plasma prothrombin antecedent factor. Factor 12 is Hedgeman factor, and factor 13 is fibrin stabilizing factor. So all these factors play a very important role in the formation of blood clot. We have seen the pictorial representation of this coagulant cascades. So all of these factors play a major important role in the formation of the stable fibrin and aiding in the clot formation in the body. So let us see the classification of these coagulants. What are the coagulants nowadays used? So one of the major coagulant used is vitamin K. Vitamin K is a fat soluble vitamin which is very essential in the body, and it is synthesized by the intestinal flora or the bacteria which is present in the intestine. They synthesize the naturally occurring vitamin K in the body, and this vitamin K exists in two forms, that is vitamin K1 as well as vitamin K3. And vitamin K1 is a compound which is obtained from the plants naturally, and vitamin K3 is synthesized or else it is synthetically prepared. So vitamin K1 which is produced from the plants is called as phytadione or phylloquinone. Phylloquinone is an alkaloid compound which is synthesized or else which is present in the plants naturally. So this phytadione is extracted from phylloquinone alkaloids, and it is used as an coagulant. And vitamin K3 is synthetically prepared. It is synthetically prepared, and there are two forms of this vitamin K3 again. They are fat soluble as well as water soluble. So these can be prepared which are easily soluble in the water, and these also can be prepared which are fat soluble. So the fat soluble K3 form of vitamin K are menadione and acetaminophtone. And water soluble vitamin K3 forms are menadione sodium bisulfate and menadione sodium diphosphate. There are various other drugs apart from vitamin K. There are various other miscellaneous drugs like rutin, ethamsalate, fibrinogen, anti-hemophilic factor, and desmopressin and adrenochrome semicarbazole. These are the various miscellaneous drugs which are used as coagulants, but majorly the coagulant which is used or else which is marketed as formulation as vitamin K. Let us see this vitamin K. What is the structure of this vitamin K? This vitamin K, we can see the structure. It contains naphtha-quinone ring. Naphtha-quinone ring is the major compound. It contains two benzene rings attached together. Here we can see the naphtha-quinone ring, and it is attached with aliphatic side chain. It has some side chains with double bonds as well as some carbon atoms which are attached to that. So this is the structure of vitamin K1 or vitamin K common structure. And this vitamin K is mainly fat soluble vitamin, and it plays a major important role in the formation of four factors, that is factor 2, factor 7 and factor 9 and factor 10. So this vitamin K plays a very important role in the synthesis of these clotting factors, and it aids in the formation of or else it aids in the process of coagulation. So how does this vitamin K occurs? Vitamin K naturally occurs by the intestinal flora, or else it is synthesized by the intestinal flora naturally. But vitamin K can be intake into the body through the dietary sources like leafy vegetables. It is very rich, or else it is richly present in leafy vegetables like spinach, cabbage, liver, as well as cheese, etc. And these are the few of rich sources of vitamin K. And this vitamin K, it acts as a cofactor in the synthesis of various prothrombin protease factors. The prothrombin protease complexes. It aids in the formation of prothrombin protease complexes, and along with it is aiding in the, or else it acts as a cofactor in the formation of factor 7, factor 9, as well as factor 10, along with 2, 7, 9, 10. So apart from these, it also plays a very important role in the formation of other factors like 5, 11, as well as 12 also. But majority, or else major synthesis occurs by the, or else majority of the coagulation, major synthesis is occurring by the formation, or else by the synthesis of factors of 7, 9, 10. It also have a special characteristic feature that it can bind to the calcium, and it, or else it forms a complex with the calcium, and where it is easily transported through the phospholipid surface. So our cells have some phospholipid membranes around them. So this calcium is one of the clotting factor, as we have seen in the clotting factors list. So this calcium is one of the clotting factor, and this vitamin K has a special characteristic feature to bind to that calcium, and whereby the calcium is easily transported into the cell and thereby forming a clot. How the vitamin K should be taken, or what is the daily recommended dose of this vitamin K? Vitamin K is usually taken in the dose of 50 to 100 microgram per day for adults. And how it is utilized, or else what happens if vitamin K is taken inside the body, or else how this vitamin K is utilized in the body. So this vitamin K is absorbed mainly from the intestine. So as I told you, it is synthesized by the intestinal flora, and in the body whatever the compounds are there, 99% of absorption takes place in the intestine only. So vitamin K is easily absorbed from the intestine, because intestine contains some characteristic features or hair-like projections called villi. So maximum amount of absorption of organic as well as inorganic compounds takes place in the intestine. And apart from that, it is stored in the liver. So if there is any excessive amount of vitamin K present in the body, it is stored in the liver, and it needs bile salts for metabolism. So there are bile salts which are synthesized, or else which are secreted in the body from gallbladder. So from gallbladder, bile salts as well as bile pigments are secreted out. So this vitamin K metabolism needs bile salts in order for the conversion of inactive form to active form, or else for the storage of vitamin K. So this vitamin K as such cannot be stored. It has to be converted to some sort of form, or else it has to be converted to some kind of different structure or as different compound where it can be stored easily in the liver. So for this conversion or for metabolism of vitamin K, these bile salts and bile pigments play a major important role. And the other one is metabolized in the liver by side chain cleavage and glucuronide conjugation. So glucuronide conjugation is one of the major biotransformation reaction, and 90% of the drugs undergo glucuronide conjugation biotransformation in the liver. For suppose if we take paracetamol, or else if we take aspirin as well as various other common drugs, which when we intake into the body, they undergo pharmacokinetic parameters like absorption, distribution, metabolism as well as excretion. So this metabolism is taking place in the liver, and 90% of the drugs undergo glucuronide conjugation type of biotransformation metabolic reactions, and it is excreted in bile as well as urine. Though the excretion of this vitamin K takes place, majorly it takes place in the urine, but if at all any traces are remain, then it is excreted in the bile also. Here we can see the mechanism of action of vitamin K1. So vitamin K1, which is also called as quinone, This quinone, it exists in two forms, active form as well as inactive form also. So the inactive form of vitamin K1 is quinol, and the active form of vitamin K1 is 2,3-epoxide. So the inactive form is converted to active form with the help of an enzyme called as 2,3-epoxidase reductase and the carboxylase epoxidase. So these are the two enzymes which are mainly aiding in the formation of active form. Here from vitamin K1, that is quinone, vitamin K1 inactive form is formed with the help of an enzyme called as vitamin K1 2,3-epoxidase reductase, and where vitamin K1 2,3-epoxidase is converted to quinone, and where the quinone is further converted to quinol, which is an active form. And this active form is again converted to inactive form in the presence of an enzyme called as carboxylase epoxidase. So this is like a cycle. So this cycle forms active form of K1, and this active form of K1 aids in the formation of coagulation factors like 2, 7, 10 and 9 along with the protease prothrombin proteins which are present in the body. Toxicity. So what happens if overdose of this vitamin K is taken? So this vitamin K is given in the IV form, or else it is given through injection. So when rapid IV injection is given, it forms redness, flare or blushing of that particular area, and sometimes it may cause swelling as well as pain at the site of injection. And death by this vitamin K overdose is very rare, in very rare conditions, or else in the conjugation, or else if the patient is suffering from various disorders and if he has some contraindication for this vitamin K, and if vitamin K is administered to that particular patient, then death can be seen in that particular patient. We have saw the menadione, which is the K3 water soluble form of K3 vitamin. So it has some adverse effects, like it causes hemolysis in dose dependent manner. So dose dependent manner is a case like in the particular dose, or else if when we give vitamin K in this particular dose only, it shows its action. So menadione is such a form which is dose dependent, and if it is not given in proper dose, it causes hemolysis or breakdown of that particular vitamin K, where it shows nil effect or there is no use when administered in this condition. And the other one is menadione causes kernicterus in newborns. Kernicterus is a condition where there occurs some disturbances or fluctuations in the bile salts, or else bilirubin related brain disorder. If there is any excessive amount of bilirubins or bile salts secreted in the body, then it is directly entering into the brain via blood-brain barrier, and where it causes brain dysfunction. So when menadione is administered in newborns or infants, it causes kernicterus. What are the therapeutic uses of this vitamin K? Vitamin K is used in the treatment of various diseases or disorders. For example, if there is any vitamin K deficiency, so while dietary vitamin K deficiency, if the vitamin K is not available in the body through food or through diet, then vitamin K supplements are given. And this vitamin K deficiency is rare in adults because most of the adults take their diet properly. If there is any deficiency occurring because of diet, then it is in infants, or else then it is in children only. So the recommended dose for the vitamin K dietary deficiency is 5 to 10 mg per day orally or parenterally. It is also given in prolonged antimicrobial therapy. So in this antimicrobial therapy, when antimicrobial therapy is given for longer period of time, then occurs vitamin K deficiency. Then this vitamin K supplements are given, and the dose is same as that of we have seen before. That is, it is usually given in 5 to 10 mg per day orally or parenterally. It is given in liver diseases. If there is any liver disease or disorder, then the patient is recommended to give vitamin K supplements. And it is also given in obstructive jaundice or malabsorption syndromes. So if there is any obstructive jaundice, so it is a condition where excessive amount of bilirubin is secreted in the body. So in this condition, then vitamin K is given in the form of its supplements, or it is given orally or parentally. Mostly it is given in parenteral route, and it is administered in the dose of 10 mg IM. That is, it is given through intramuscular route. And newborns. This vitamin K is strictly inhibited in newborns. It should not be given to newborns because it causes a disease or disorder condition called as kernicterus. But if at all it is recommended, if at all it is necessary, or else it has to be administered in emergency, then small amount of vitamin K can be administered. That is about 1 mg can be given to the newborns. So, overdose of oral coagulants. So we take oral coagulants. There are oral as well as parenteral coagulants. So if there is any excessive or else overdose of these oral coagulants, it causes deficiency of vitamin K. So then in that condition, vitamin K supplements are given through parenteral route, because in some conditions when this oral coagulants are taken, they undergo metabolism, and when this complete metabolism of oral coagulants taking place, they exist in inactive forms, or else if they are dose dependent coagulants, then it causes depletion of that particular oral coagulant, which is of no use. So in that condition, parenteral route of vitamin K supplements are usually given in order to prevent this vitamin K deficiency. So what happens, or is what is the deficiency, or what are the conditions we observe if there is any deficiency of vitamin K? So there are various liver diseases which occur when there is deficiency of vitamin K. It causes obstructive jaundice also, and it causes malabsorption. It causes deficient diet and long-term antimicrobial therapy. So this vitamin K deficiency occurs in all these conditions. If there is any liver disorder, if there is any obstructive jaundice, if there is any long-term antimicrobial therapy, or if there is any deficiency in the diet, then definitely the patient will have deficiency of this vitamin K, or else he will suffer with the deficiency of vitamin K. So let us see the other miscellaneous drugs of which are acting as coagulants. Majorly vitamin K is only marketed, but there are other coagulants also which are called as miscellaneous drugs. So the category includes the first drug called as fibrinogen. So fibrinogen is a coagulant which is mainly administered, or else it is employed in the condition called as hemophilia. Hemophilia is a condition where there is excessive bleeding. So in this condition, fibrinogen is given, which acts by the mechanism of forming fibrin. So it mainly acts in the final step of formation of fibrinogen to fibrin and fibrin to stable fibrin. So this fibrinogen acts at this particular step, which aids in the coagulation of the blood, and it is recommended in the dose of 0.5 mg IV route. The other drug is anti-hemophilic factor. So hemophilia is a condition of loss of blood. So the name itself indicates anti-hemophilic factor, which is acting against a condition called as hemophilia. So it is a concentrated human AHG protein. So this anti-hemophilic factor is a protein. It is a protein form, and it is present, or else it is prepared synthetically in the concentrated form. The concentrated form of this anti-hemophilic factor is available, and it is recommended to give in the condition called as hemophilia, and it is very effective in the condition called as hemophilia, and it is short acting. And this is the onset of action of this hemophilia is very rapid. Once administered, it exerts its actions. The other drug is desmopressin. So desmopressin is a drug which releases the factor 8 as well as non-Willebrand's factor. So this desmopressin is the drug which acts mainly in the formation of clotting factor 8. And along with that, von Willebrand's is one of the additional factor which sometimes aids in the coagulation of blood. So if there is any deficiency occurring in this factor, it causes a syndrome called as von Willebrand's disease. So in this condition, this desmopressin is used. This is a very characteristic drug which is only used if there is any deficiency occurring in this particular factor, and it is the only drug which is used in the synthesis of only clotting factor 8. Adrenochrome monosemi-carbazone. This is one of the miscellaneous drug which is used as a coagulant. It reduces capillary fragility. So the capillaries, we have blood vessels which are present in the body. Blood vessels, we have arteries, veins, capillaries, and minute capillaries which are present in the body. So these capillaries are network of blood vessels which are very sensitive. So this particular drug, what does it do? It reduces capillary fragility. So if there is any loss of blood, then these capillaries become fragile, or else they are easily breakable. So this drug adrenochrome, it prevents the capillaries to become fragile, and thereby it aids in the it exerts its action of coagulation. And its efficacy is uncertain. In the sense, we can't predict whether it is efficient in the body once administered, and it is given in the dose of 1 to 5 mg orally by IM route. It is given orally or IM route. The other drug is rutin. Rutin is a naturally occurring plant glycoside. So rutin is a drug which is prepared from plant glycoside, or else it is extracted from the plant glycoside, and it is reduced capillary bleeding. So if there is any excessive bleeding in the capillaries, then rutin will reduce the capillary bleeding. And when it shows more effect, or else it has higher efficacy when it is administered along with vitamin C, or else the effect will be synergic, or it shows synergistic effect when it is administered along with vitamin C. And the recommended dose is 60 mg orally, and this efficacy is also, the efficacy of this particular drug is also uncertain. In the sense, once it is administered, we can't predict the efficacy of that drug, or we can't say whether the drug is showing its action immediately or not once administered. Action is shown, but we can't say whether it is very efficient or not when compared to other coagulants. Ethamsalate. Ethamsalate is the last category of the coagulant drug. It also reduces capillary bleedings when platelets are adequate. So when there is platelets are present in adequate conditions, also there might not be proper clot taking place. So in this condition, if we administer ethamsalate, it aids in the formation of clot along with platelet aggregates. It is used in the prevention and treatment of capillary bleeding in menorrhagia and epistaxis and melena-like conditions. So these are the conditions. Epistaxis is a condition where there occurs bleeding in the nose. So if there is any bleeding in the nose, then this drug is usually recommended to form a clot in that particular area. So in this condition, platelets are present in adequate amount, but the thing is, formation of clot is not proper, or there is occurring excessive bleeding. So in that condition, ethamsalate is preferred or recommended, and dose is about 250 to 500 mg, which is given orally.